Alright, so this is a cranial nerve video with Danny Adams starring as the doctor and AJ McCleary starring as the patient. So we'll go ahead and get going. So first thing we're going to test is cranial nerve 1, because that only makes sense, the olfactory nerve. So Danny will have AJ the patient close his eyes and occlude one nostril, and then Danny will present a familiar substance to that nose and see if AJ can identify it.
Cinnamon.
Perfect. Go ahead and include the other nostril. And what do you think this is? You might switch it on you.
Cinnamon.
Still cinnamon, was that correct?
That's correct.
All right, wonderful.
Were they equal on both sides?
Yep.
Great. So unilateral loss would be indicative of a frontal lobe lesion. Next thing Dr. Danny will test will be the optic nerve. In order to test this, you can do many different tests, including visual acuity, color vision, the red cap test, pupils, and direct ophthalmoscopy. But for our purposes today, we're just going to have him test the confrontation visual fields.
Go ahead and take off your glasses. Cover up your left eye. Look at my open eye and tell me how many fingers you see out here.
1, 2, 1, 5.
Good. Switch over to your other eye. Look at my open eye here. The same thing.
2, 2, 2, 1.
Great.
Very good. And that was normal, obviously. Next, we can test both cranial nerves 3, 4, and 6 by doing extraocular motilities or performing a Parks 3-step if warranted, if suspicious of a deficit in one of those nerves. And so we'll go ahead and have Doctor perform that.
All right. Go ahead and look right at my tip here. Let me know if you feel any pain or see double. Feel any pain?
Nope.
Double?
Very good. To check cranial nerve 5, the trigeminal nerve, it has both sensory and motor portions. So to test the motor portion, we'll have the patient clench their teeth and have the doctor palpate the masseter muscles as the patient does that, checking for symmetry between those two muscles.
All right, go ahead and clench your teeth. And release. And clench. And release. Great. They're equal on both sides.
Very good. To test the sensory portion, we'll take a cotton wisp and go ahead and run it along both the ophthalmic, maxillary, and mandibular portions of the face and just check for symmetry there.
Okay. Go ahead and close your eyes for me, AJ. Can you feel that?
Mm-hmm.
Is that equal to this?
Yep.
And is that equal to there?
Yes.
Great. Same thing on the other side. So did you feel that?
Yep.
Is that equal to here?
Mm-hmm.
One more. Equal to there?
Yep.
Great.
Awesome. As another test we could do, we won't do today, but the corneal sensitivity test, go and use the end of a cotton wisp and touch it to the patient's cornea and ask if they feel it. They'll most likely blink, which would also be testing cranial nerve 7, the motor portion to the eyelid. Wonderful. So we'll now go on to test cranial nerve 7. In order to do that, we'll have the patient close their eyes and attempt to force their eyelids open as the doctor feels for the strength of that muscle.
All right, I'm going to try and open up your eyelids. You keep them closed. About equal on both sides.
Great. And then also, we'll ask the patient to smile and then frown.
Smile and frown.
Very good. And then also puff your cheeks out while the examiner presses on both cheeks, looking for symmetry.
Just try and resist my hands here. Great. Equal on both sides.
Wonderful. Now we'll go ahead and test the cranial nerve 8 acoustic. So have the patient close your eyes, and then using the tuning fork, we will strike the tuning fork and then place it on the vertex of the scalp for the Weber test. You should hear it equally on both sides.
Yep.
Wonderful. The next test we'll do is striking the tuning fork and then placing it on the mastoid process, and then once the patient can no longer hear it, moving it into air in front of the ear, and the patient should hear it louder in the air in front of that ear.
I'm going to place it right here. You tell me when you can no longer hear it.
There.
Is it louder here?
Oh, yeah, definitely.
Okay. Same thing on the other side. Let me know when you can no longer hear it. And there?
Yep.
It's louder there?
Mm-hmm.
Great.
Great, okay. Now we'll move on to the glossopharyngeal and vagus nerve we'll test together. First, we've been hearing AJ talk a little bit, but we'll listen to the sound of his voice, checking for hoarseness. So AJ, go ahead and say, Sally sells seashells at the seashore.
She surely does.
Very good. And then we'll have him open his tongue or open his mouth and say ah, and we'll look at the soft palate and uvula to see if there's any deviation.
Stick your tongue out. There's no deviation.
Great. If there were a deviation, the uvula would deviate towards the normal side in that case. All right, now we'll go ahead and test the spinal accessory nerve. So we'll have the patient try and raise their shoulders while Danny places his hands on the patient's shoulders, trying to resist that motion, and check for equal on each side.
All right, shrug your shoulders, try and resist me here. Great, it's equal on both sides.
Great, now we're going to test the same thing with AJ trying to turn his head while the doctor resists.
This side. Good, it's equal on both sides.
Great, now the final nerve we're going to test will be the hypoglossal nerve. We'll have the patient stick their tongue out and just see if it deviates to either side.
Good, stick your tongue out. Came out straight.
Very good. And looks like AJ is normal.